NPHET are completely out of touch. The minutes of their meetings show scant regard for the general health of the nation. Their definition of health is zero COVID. The real definition of health is a mental, physical, social well-being where disease and infirmity are absent. NPHET believe your health is determined by a swab result. This meaningless data is just being used to subdue the people of Ireland. I would argue that health is singing a song to a crowd like this. Health is playing a match or supporting your team in the stands with your friends. Health is getting married and sharing the day with the people you love. Health is being able to stand up here and see a sea of maskless faces. NPHET don't understand this. They can only think in terms of lockdowns, and they see us as just COVID positive and COVID negative. When all you have is a hammer, all you see is nails. I was talking to an old man during the week who was saying how he missed his weekly card game with his group of friends in the local pub. This game had been going on for over 20 years. It may seem like a trivial thing to talk about, but it's social events like this that make life interesting and enjoyable for people. This card game and the social fabric of the country has been taken away from the people because of a lie. If you check out the HSE website, it says that your risk of death if you get COVID is 1 in 22. The true figure, if you get COVID, is 1 in 300. And there's evidence that 80% of the population are not even susceptible to COVID. This is why the mathematical models that they used to justify these lockdowns are so wrong. And this is why Sweden is living free now. There is no second wave of deaths. They need to stop the daily reporting of case numbers. It means nothing. The only numbers that matter are the numbers in ICU and deaths, which are very low. When compared with other years, there were excess deaths from late March to early May, amounting to about 900, and not the 1,800 that they keep pushing in our face. There are now no excess deaths since early May, and this is why the case number reporting must stop. They're just using it to demoralize and subdue the people. My mother is 88. She says she's not afraid of COVID. She remembers the Second World War, and then life went on despite the turmoil. There were no Panzer tanks in Ireland, but there was a killer that took 2,000 to 3,000 people every year in the 20s, the 30s, and the 40s. Only in the 1950s did we begin to overcome this enemy. People contracted it the same way that you contract COVID. But unlike COVID, it took people in the prime of their lives. This enemy was called TB, tuberculosis. But back then there was no NPHET to lock down Ireland and shut the schools and the places where we meet and work. There was no NPHET to hijack the country. We must remember that unlike TB, COVID kills people with an average age of 84. The average life expectancy in Ireland is 82. 90% of the deaths are in those over 65. So by any reasonable definition at this point, COVID is no longer a health emergency. We must take back our country and our freedoms from these megalomaniac bureaucrats. Dr. Noel Brown would turn in his grave to see what has been done to this country in the name of public health. I speak from my own experience as a GP. I worked in a COVID hub during the early part of the pandemic, and I still see COVID patients in my own experience, in my own practice, I mean. So I've seen lots of it, and a fairly full spectrum of it as well. For many, it is a mild illness, but for some, I accept that it can be quite serious, especially for those with multiple comorbidities, such as older age, obesity, heart, lung disease, and diabetes. In defiance of guidelines from the HSE, I used hydroxychloroquine, zinc, azithromycin, and readily available vitamin D in combination in high-risk patients that got sick with COVID in my patient population. Hydroxychloroquine's been around for 70 years. It's been used for the treatment of malaria and autoimmune diseases. It's freely available over the counter in many parts of the world. With the arrival of COVID, we were told all of a sudden that it was a dangerous drug. I didn't believe this, and I did my own research, and I found lots and lots of evidence for it. There's even one study from 2005 that showed that hydroxychloroquine is very effective against the first SARS virus, and this study has been cited over nearly 1,000 times. I can say I took hydroxychloroquine myself as a preventive during the early part of the pandemic when I worked in the hub. These medicines work, they are safe. I have treated patients who've had multiple comorbidities and have been very vulnerable and were tested positive for COVID. I treated them with hydroxychloroquine. When I explained the rationale and I told them that it wasn't licensed, they were delighted that I offered it to them. None of these patients had to go to hospital. They all made good recoveries. These cheap and safe medicines work if you use them early, not late. That's why they're so suitable for use in the community. I ask, why is the HSE trying to tie my hands behind my back when all I want to do is keep my patients out of hospital? The answer, I suspect, has something to do with money and influence. No vested interest in Big Pharma or the corrupt WHO will make money out of hydroxy. Hydroxy is widely used in Switzerland, South Korea, India, and Russia. It's no coincidence the death rates are much lower in those countries. And ask yourself why Tom Hanks, the famous actor, gets this medicine when he got COVID in Australia earlier in the pandemic. While at the same time, Australian doctors risk criminal sanction if they prescribe it for their own patients in the community. Things are changing slowly, however, and in the US, restrictions on doctors prescribing hydroxy are being rolled back in an increasing number of states. Obstructing access to cheap, safe medicine proven to save lives is legally indefensible. As Michael McDowell, former Justice Minister and Attorney General, recently said, the people of Ireland are getting the mushroom treatment. The government is playing on people's primitive fears of unseen danger. Just like the danger that lurks in the dark, this virus is invisible, but fear is no way to fight it. Crashing the economy and crushing the morale of people with lockdowns and useless mandatory masks in low-risk settings also is not a solution. Sweden shows us what life with COVID could be like. And what about a vaccine? The government plan is to leave us waiting for God knows how long. The young of Ireland have been told to postpone their youth. This isn't fair or just. And when we were talking about vaccines, we all know that you can still get the flu if you get the flu vaccine. So how successful will this vaccine be? Will it be enough to satisfy the zero COVID fanatics in FET? I doubt it. And why this sinister plan to mandate vaccination for the whole population? There's no discussion about why this is a new and drastic plan is needed. We must stop the government's heavy-handedness and suppression of our hard-fought freedoms. It suits them not to give them back to us. We went along with the government strategy in March when we saw the chaotic scenes in Spain and Italy. But now we know so much more. The curve has been well and truly flattened, and the current measures are way more damaging to health than the risk of COVID they pretend to be protecting us from. Every day in my practice, I see the negative physical and psychological fallout of these continuing restrictions. NPHET, as it currently stands, should be scrapped, in my belief. Doctors should be allowed to treat high-risk patients in the community. This way we can keep them out of hospital. Yeah. The daily case numbers must stop being pushed by the media in our face on a people that are suffering more from COVID fatigue than COVID itself. The lockdowns must stop. People miss the camaraderie of sport and the arts and music. It's time to stop existing and to start living again. Ireland under NPHET's fear-mongering propaganda is getting sicker by the day. I'm asking for courage in those with integrity, if there's any left, in the media and the Oireachtas, because there's a better path for Ireland. A path that promotes all aspects of health and not just the absence of one disease. Thank you very much.
I just want to say it takes huge courage in the times we're living in, guys, for two GPs to come up here and speak out publicly.